Pulmonary fibrosis. Pulmonary fibrosis refers to scarring of the lung tissue. The word pulmonary means lung and the word fibrosis means scar tissue. Over time, the scar tissue blocks the movement of oxygen from inside the tiny air sacs in the lungs into the bloodstream. Pulmonary fibrosis is a form of interstitial lung disease. Some interstitial lung diseases don't include scar tissue. When an interstitial lung disease does include scar tissue in the lung, we call it pulmonary fibrosis. There are over 200 different types of PF, and in most cases, there is no known cause. Pulmonary fibrosis with no known cause is called idiopathic pulmonary fibrosis. The lung damage caused by pulmonary fibrosis can't be repaired, but medications and therapies can sometimes help ease symptoms and improve quality of life. Causes. Pulmonary fibrosis can be caused by many different factors, including long-term exposure to environmental toxins, certain medications and medical conditions, radiation therapy, and chronic inflammation and infections. Factors that make you more susceptible to pulmonary fibrosis include age. The disorder is much more likely to affect middle-aged and older adults. Sex. It is more common in men, but the number of cases of IPF in women is on the rise. Smoking. Cigarette smoking increases a person's risk of developing PF. Occupation. Exposure to pollutants known to damage the lungs. Cancer treatments. Having radiation treatments or using certain chemotherapy drugs can increase the risk of pulmonary fibrosis. Genetic factors. Some types of pulmonary fibrosis run in families. Gastroesophageal reflux disease. Many people with idiopathic pulmonary fibrosis may also have gastroesophageal reflux disease, a condition that occurs when acid from the stomach flows back into the esophagus. GRD may lead to a more rapid progression of the condition. Symptoms. Signs and symptoms may include shortness of breath, particularly during exercise, a dry cough, fatigue, tiredness, fast shallow breathing, decreased exercise tolerance, loss of appetite, unexplained weight loss, muscle and joint aches, widening and rounding of the tips of the fingers or toes. Pulmonary fibrosis often gets worse over time. Symptoms vary depending on the cause of pulmonary fibrosis. In some people, pulmonary fibrosis progresses very quickly while others live with the disease for many years. Diagnosis. To diagnose the condition, your doctor may review your medical and family history, discuss signs and symptoms, and perform a physical exam. During the physical exam, your doctor will use a stethoscope to listen to your lungs. If your doctor hears a crackling sound when listening to your lungs, that is a sign you might have pulmonary fibrosis. He may also suggest one or more of the following tests. Imaging tests, chest X-ray. The chest X-ray may or may not be abnormal. This may show the scar tissue typical of pulmonary fibrosis, and it may be useful for monitoring the course of the illness and treatment. However, sometimes the chest X-ray may be normal and further tests may be required to diagnose pulmonary fibrosis. CT scan. A special X-ray test called a high-resolution CT scan will frequently demonstrate the extent of lung damage. Pulmonary or lung function tests give information about the amount of air the lungs can hold and how forcefully you can empty air from the lungs. This can help your doctor understand the extent and severity of lung damage. The most basic test is spirometry. In spirometry, you exhale quickly and forcefully through a tube connected to a machine. The machine measures how much air your lungs can hold and how quickly you can move air in and out of your lungs. Other tests include a 6-minute walk test, pulse oximetry, arterial blood gas test, and blood tests. Lung biopsy. Although a surgical biopsy is more invasive, it may be the only way to obtain a large enough tissue sample to make an accurate diagnosis. This procedure may be done as a minimally invasive surgery called video-assisted thoracoscopic surgery, or maybe by using bronchoscopy or as an open surgery. Treatment. There is currently no cure for idiopathic pulmonary fibrosis, but there are several treatments that can help improve symptoms temporarily or slow the disease progression, and others may help improve quality of life. Patients with idiopathic pulmonary fibrosis who are current smokers are encouraged to quit. It's also recommended that patients with IPF receive vaccination against influenza and pneumococcal infection. Oxygen therapy. Breathing oxygen through a mask. You can do this while you are at home or while you are out and about. Using oxygen can't stop lung damage, but it can make breathing easier and improve your sleep and sense of well-being. Medications. There is no evidence that any medications can help this condition since scarring is permanent once it has developed. To reduce the rate at which scarring worsens, doctors may prescribe two drugs such as pirfenidone and nintedanib. These medications may help slow the progression of idiopathic pulmonary fibrosis. Doctors may recommend antacid medications to treat GERD, a digestive condition that commonly occurs in people with idiopathic pulmonary fibrosis. Pulmonary rehabilitation. Pulmonary rehabilitation programs focus on physical exercise, breathing strategies, nutrition, counseling and support, and disease management. Lung transplant. Lung transplantation may be an option for people with pulmonary fibrosis. Having a lung transplant can improve your quality of life and allow you to live a longer life. However, a lung transplant can involve complications such as rejection and infection. Complications. Complications of pulmonary fibrosis may include high blood pressure in the lungs or pulmonary hypertension. Pulmonary fibrosis causes decreased oxygen levels in the blood. A decrease in blood oxygen level can lead to elevated pressure in the pulmonary artery, a condition known as pulmonary hypertension. This results in increased workflow and ultimately failure of the right side of the heart, which pumps the blood through the lungs. This failure can result in leg swelling and overall fluid accumulation in the body. Other complications include respiratory failure, lung cancer, and lung complications. Outlook. Pulmonary fibrosis is a chronic progressive disease. The prognosis is poor for pulmonary fibrosis. Patients with pulmonary fibrosis experience disease progression at different rates. Some patients progress slowly and live with PF for many years, while others decline more quickly. It's very difficult to predict how long someone with IPF will survive at the time of diagnosis. The survival for most patients is less than 5 years. Thank you.